Today's episode is all about answering your most frequently asked questions regarding Evrysdi, one of the key treatments available for individuals with spinal muscular atrophy. If you or someone you love is considering or currently using Evrysdi, this video will help clear up some of the confusion and provide insights into what to expect. Let's dive into our FAQ regarding Evrysdi treatment. What is Evrysdi, and how does it work? Evrysdi, also known by its generic name risdiplam, is an oral treatment for SMA approved by the FDA in 2020. It's a disease-modifying therapy that works by increasing the production of the SMN protein, which people with SMA lack. This protein is essential for the survival and function of motor neurons, which control muscle movement. By boosting SMN protein levels throughout the body, Evrysdi helps improve or maintain muscle function and delay progression of the disease. Who can take Evrysdi? Evrysdi is approved for use in infants, children, and adults with SMA, starting as young as 2 months old. It's the first and only oral SMA treatment available, making it more accessible for people who may not tolerate or have access to spinal injections like Spinraza or gene therapy like Zolgensma. How is Evrysdi taken? Evrysdi is taken once daily by mouth or through a feeding tube. It comes as a liquid and must be taken at the same time every day after a meal. Consistency is key with Evrysdi. Missing doses or inconsistent use can reduce its effectiveness. It's not just convenient, it empowers people with SMA and their families to administer treatment from the comfort of their home. What are the benefits of taking Evrysdi? Evrysdi is shown to improve or stabilize muscle strength, swallowing ability, and even breathing in some cases. For infants and young children, it can support milestones like sitting or crawling. For teens and adults, it often helps preserve function, preventing further decline. While not a cure, it helps manage SMA progression and improve quality of life. Are there any side effects? Yes, like all medications, Evrysdi comes with potential side effects. The most commonly reported include fever, diarrhea, rash, mouth ulcers, headache, upper respiratory infections. Some individuals may also experience increased liver enzyme levels, so regular blood monitoring is advised. While side effects vary from person to person, many people report that they are mild and manageable, especially compared to the potential benefits of the drug. How soon can I expect to see results with Evrysdi? The timeline for seeing benefits differs for everyone. Some patients experience improvements in strength and stamina within a few weeks to months, while for others, the benefits may take longer and may present as stability, meaning no further decline. Remember, stability in SMA is a huge win. Stopping disease progression is just as important as improving symptoms. Can Evrysdi be used with other treatments? Evrysdi has not been approved for concurrent use with other SMA disease-modifying therapies like Spinraza or Zolgensma. However, doctors may evaluate each patient's case individually. In some situations, someone who receives Zolgensma earlier in life might later transition to Evrysdi, but this requires thorough medical discussion and planning. Always consult with a neurologist or SMA specialist before making changes to your treatment plan. Is Evrysdi covered by insurance? Yes, most insurance providers in the US, including Medicaid and private insurers, cover Evrysdi, though the level of coverage and prior authorization requirements can vary. Genentech, the manufacturer of Evrysdi, also provides financial assistance programs for those who qualify. If you're having trouble with insurance, reach out to Cure SMA or Evrysdi Access Solutions for support navigating the process. How does Evrysdi compare to other SMA treatments like Spinraza or Zolgensma? Each SMA treatment has its pros and cons. Here's a simple breakdown. Evrysdi, oral, daily dosing, systemic effect, convenient. Spinraza, administered via spinal injection every 4 months. Zolgensma, one-time infusion, gene therapy approach. Evrysdi stands out for its convenience and ability to reach multiple tissues, not just the central nervous system. However, some people prefer a one-time option or an injection-based treatment. The best choice depends on age, SMA type, health condition, and access. What happens if I miss a dose? If you forget to take your dose of Evrysdi, take it as soon as you remember on the same day. If it's already the next day, skip the missed dose and continue with your regular schedule. Do not double up on doses. It's also important to store the medication properly in the refrigerator and use it within the prescribed time frame. Evrysdi represents a major advancement in the fight against spinal muscular atrophy. While it's not a cure, it offers real hope and meaningful progress for individuals living with SMA, improving quality of life and helping families regain a sense of control. If you or someone you love is exploring SMA treatments, knowledge is power. Talk to a neurologist, ask questions, and don't hesitate to reach out to patient advocacy organizations for support. Thanks for tuning in. If you found this helpful, please like, share, and subscribe for more SMA awareness content. You are not alone in this journey. Until next time, stay informed, stay hopeful, and stay strong.